I'm Roman Tawakkol, an MD from Afghanistan and a long-time trainee of mine, and I'm glad I'm here to present this record today. My presentation is about adopting MCHAT to Dari, cultural and linguistic consideration for effective autism screening. I will talk about MCHAT and why it is important to translate medical screening tools and a checklist into multiple languages, and what are the translation steps. MCHAT stands for Modified Checklist for Autism in Toddlers, and it was developed by Dr. Diana Robin and Deborah Finn and Mariana Barton in 1999. It is a two-stage parents report or professional report screening tool to assess the risk for autism spectrum disorder in toddlers in age between 16 to 30 months. It includes an initial questionnaire and a follow-up flowchart to reduce the false positive rates. The American Academy of Pediatrics recommends that screening for autism should be conducted for all children at 18 to 24 months during a child visit. And CDC report the average age to diagnose autism, 4 years old. By using MCHAT, we can lower the average age of autism and improve health outcome. And it also allows early intervention at younger ages. Here I added a QR code for MCHAT file and website. Another QR code and link about how to score using MCHAT. I will briefly explain how we can use the MCHAT Initiate checklist to score. Here we have 20 questions. Question number 2, 5, and 12. If the answer is yes, so each will have 1 point. All other questions, the answer no, each would have 1 point. If the child scores 0 to 2, so that child is at lower risk, we don't need to follow up, except if the child is younger than 2 years old, so we need to do rescreening at age 24 months. If the child scores 3 to 7, that child is at moderate risk. We have to administer the MCHAT revised follow-up items that correspond to the at-risk responses. It means only those items which were scored at risk need to be completed again. If 2 or more items continue to be at risk, so we have to refer that child immediately for early intervention or diagnostic evaluation. If the child scores 8 to 20, that child is at high risk. It is not necessary to complete the MCHAT revised follow-up. We can bypass that, and we should refer the child immediately for early intervention and diagnostic evaluation. Why it is important to translate the screening test? We all know that medical checklists and screening tools ensure standardized procedures and protocols in healthcare settings. And the provision of healthcare services should be equitable and accessible to all individuals, regardless of their language or cultural background. So translation of medical screening tools promote equity in healthcare by ensuring that language differences do not prevent individuals from accessing essential medical services and information. It also ensures that healthcare information is culturally sensitive and understandable to diverse populations, which promote effective communication and patient trust. It also facilitates early detection and intervention, leading to better health outcome. As I mentioned before, that MCHAT can decrease the average age of diagnosis for autism to less than 3 years old. While interpreting, we should know our limitation. If you find that you are struggling, find a word to translate, you can easily say it is a linguistic or culturally sensitive phrase. In a high context culture, one word can have different meaning depending on how it is expressed, and vice versa in low context culture. Example of cultural and linguistically sensitive question in MCHATs are here. which I would say by providing a beautiful example, they makes things easier. One of these questions is, does your child look you in the eye when you are talking to him or her, playing with him or her, or dressing him or her? I would say this question can be considered culturally sensitive because the significance and the frequency of eye contact can be vary widely across different cultures. In some cultures, direct eye contact is perceived as a sign of respect, attention, and engagement in communication, while in others it may be seen as a disrespectful, particularly when you interact with authority figures or elders. The other question is, does your child respond well when you call his or her name? For example, does he or she look up, talk or bubble, stop what he or she is doing when you call his name or her name? So this question is a language sensitive because it acknowledges that children may respond to their name in various ways, include verbal responses or nonverbal, like looking up. It recognizes that language development can vary among children and doesn't assume a specific linguistic response. Translation, especially medical translation, it's required a level of precision and accuracy unmatched in any other areas. When a patient's health and safety are online, results less than 100% accurate are unacceptable. So what are the steps to ensure an accurate translation? First, understand the source text, which I review the MChat file in English version, an actual version I mean. Then doing some researches. I researched about the MChat, why we are using the MChat, how we are scoring, how we are using, and some, Farsi type or Farsi translated MChat, which is very close to Dari language. Then I identify the target audience, which I consider them as parents with limited education and knowledge about kids. Later on, translation, using two-finger method to translate and following all the proofreading steps. Reviewing the file multiple times alongside the actual version. Editing, considering all cultural sensitivity related to the language. And for quality assurance, we should forward the file to a professional medical translator to evaluate. Perform a final review to ensure the translation meets the quality standards and accurately conveys the intended meanings. Feedback and revision. Seek feedback from stakeholders, such as healthcare professionals and patients, and make necessary revision based on their inputs.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.